It's been a year since the COVID-19 virus emerged in Canada. What did the medical community originally know about the virus when it popped up compared to what they know now?
Right. I could speak, I would say, for every doctor when January 26, 2020 definitely seemed like a decade ago. I think we were quite naive on how devastating this would all be, and certainly how much it wreaked havoc in the lives lost and shattered world economies, and of course continues to manifest in new strains. The medical community is definitely looking more towards the future when everyone is vaccinated and COVID-19 is no longer a threat.
Now, what was the biggest challenge, I'm wondering, with the outbreak in early 2020 compared to the current situation we're in now?
It's a good question. The old challenge really was about information. If we look back in January, February, March, it was a race for information. Which medications worked, which ones didn't, how did it transmit, was it aerosol, was it droplet, and what precautions could we use? We know a lot more now, and certainly the new challenges that we have are more about communication. So we have the knowledge, but it's difficult to necessarily convey that knowledge in a succinct way. And the second biggest challenge we have now is, of course, logistical. We have the vaccines, but how do we deliver them and do them as fast as possible?
Now, even though we are in the second wave of this outbreak, I'm wondering what progress have we made in our fight against the virus spread? It seems like we're on an uphill battle here.
That's absolutely right. I think we have an advantage where many countries did many different choices on dealing with the virus in general. Countries such as Australia, for instance, strongly prioritized contact tracing and testing, and had a very large impact on coronavirus cases. Yesterday, for instance, the Australian count for COVID cases was 11. So what we do know is that masks, social distancing, and contact tracing works very well. We know which medications work, and we know that the vaccines work. So now it's just a matter of implementing all of those together.
Now, mental health was a serious concern among medical professionals during the first wave. How has that situation developed in 2021? Are there any supports available for medical professionals, I'm wondering?
The way I look at this pandemic is it's definitely like a world war. For instance, medical professionals and frontline workers are our soldiers, and they definitely are frontline. Just like with any war, there is significant and severe cost to mental health. Physicians are lucky where we do have some resources available. Physicians can call the Ontario Medical Association, for instance. But there's so many more to this than just physicians. There are so many more frontline workers who don't necessarily have that support. So I do hope that the government does treat this quite seriously and assist with the mental health for all frontline workers.
Now, the only recent comparable event to this recent COVID-19 outbreak was SARS, and I remember that very, very clearly. What are you finding as comparable markers between both these events and what we can learn from that SARS kind of health scare in a great way to where we are today?
It's interesting because in 2002, mostly the major cities such as Toronto were affected by the SARS outbreak. So COVID-19 wasn't necessarily our first pandemic, and it certainly won't be our last. I think the big points to remember is that investing in public health infrastructure, contact tracing, educational programs are the key to stopping any pandemic in general.
My last question to you, in terms of those infected, Statistics Canada claims death rates were higher among communities with visible minorities. How can the medical space, as well as governments, tackle this issue? I got about maybe 30 seconds for this.
Gotcha. By and large, we know that it is the poorer, the people of color, those living in poor socioeconomic conditions that face higher death rates. In fact, Statistics Canada said that the death rate is double in those populations. So the best we can do as government is to focus on public health, the social determinants of health, like housing, to decrease sickness and death.
Well, thank you so much, Dr. Abhishek Raut. Really appreciate your time for always being with us. Thank you so much.
Thanks so much for having me.